Yep, there we go. Sorry. Cool.
Yeah.
Okay, thank you for that. And thank you and welcome everyone for being here this morning. I'm very honored to be here and be able to talk with you all for the next couple minutes about behavioral health pathways in Colorado. So, like you've heard already, I'm with the Behavioral Health Administration, which previously, prior to July 1st of last year, was the Office of Behavioral Health. So the office, most of you have probably heard of that, now no longer exists for the Behavioral Health Administration. And so what we do is we oversee, for example, we oversee 2765, we oversee licensing of community mental health centers, of residential treatment services, of substance use treatment agencies, so an agency that provides any type of DUI services, for example, or any type of substance services. We oversee that and give that license out. You've probably heard people talk about their OBH or BHA substance treatment license that they need to have to do those services. So we oversee all of that. So my primary role within the Behavioral Health Administration is to oversee our addiction training program and workforce development. So within our addiction training program, we set the standards for the curriculum of the courses and addiction trainings that an individual would need to take to get certified or licensed in Colorado for addiction treatment. Okay. And with workforce development, we do a lot of these presentations. We want to get people knowledgeable about what the process is and answer questions that people have. Like you heard in the panel a few minutes ago, we need people. We want you to come and join us. Let's go on this journey together, right? So any questions or anything, you want to spread the word to others, please do so. We're just always looking for help. So I'll put that little plug in there for that. So as mentioned, I've been there for 10 years. I do have a master's in criminal justice and a master's in clinical counseling. So do have some background working with offenders as well as with our behavioral health populations as well. So that's all. That's what I got about me. Okay. So one of the things we just want to start with and have everyone just keep in mind is that people do heal in relationships. Right, that's why we go into this field. I heard just sitting in there, I came in a little bit late, but I heard just sitting there listening to the panel, people talk about, I want to help people. I want to be there for someone. I want to help them on their journey, right? So to hear people say that does energize me because that is what we do, right? And so being in those relationships and building that foundation is super important. And this is a great place to do that here in the behavioral health realm, okay? So we do help people heal. Just remind yourself of that, right? So you may hear people that have been in the field a while be like, oh, this is exhausting, right? But really at the end of the day, we really do good work. We have good quality services that we offer, good trainings that we offer. So we're just really excited and want to get more in here to help in the field. So there's my workforce plug. Did you like that? Okay. All right. So I gave you a little background. I think you have access to this PowerPoint. So there's a whole bunch of information on this, so I'm not going to read this word for word. I trust you can, I'll do that, but just wanted to give a little history on what the BHA is. Wasn't sure if people knew what the BHA was. So we were now a cabinet within the governor's, within the state of Colorado with the governor's office that Behavioral Health Administration is its own entity. So prior to this, the Office of Behavioral Health was under the Colorado Department of Human Services. So now we've shifted out of that and we're our own entity. And so just as I mentioned, we cover a wide spectrum of services, right? Children, youth and family, peers, working with criminal justice, women's services, like we cover a huge realm within our umbrella. So there's a lot to do for the BHA and workforce development. The BHA is always hiring too, state of Colorado jobs, okay? FYI, so you know. So one of the main things that we want to do is work with the whole person and really assist individuals in seeking whole person health. So that is our big long introduction to the BHA. Any comments, questions, or anything?
I thought it was interesting at the bottom, it says operated in the Department of Human Services until a permanent location is determined. Where else would it go?
Right, and that was always been the decision on the table, right? So As it's moved into its own entity, I think that's where they're going to keep it, but they had to have it ready and functioning by July 1st of 2022.
Okay,
So that's how they.
so then the legislature will determine
Yes.
or vote or something.
Yes.
On their.
Pertinent.
Okay.
Thank you, that's a good question. Okay, so we're just talk about the pathways for behavioral health in the behavioral health field. So one of the entities for the state that you're gonna hear a lot about is the Department of Regulatory Agencies. Has everyone heard of DORA? We speak of DORA a lot, right? Okay, DORA is the one that's gonna regulate your individual license. So you're working towards, for example, becoming a licensed addiction counselor. Once you meet all the requirements for that, you have your hours and your classes, your exams, all of that, you're gonna go to DORA's website and then apply for that licensure. So they're a big key component of the pathways because they're the ones that are gonna actually issue that to you, okay? Yeah, so, and if you have a complaint about somebody that's currently licensed or certified in the state of Colorado for behavioral health, you would file that grievance with the Department of Regulatory Agencies as well. So they issue the individual license. So what we do at the Behavioral Health Administration, for example, with the addiction training program, is we set the requirements for what you need to become certified or licensed. Does that make sense? Okay. So education specific for behavioral health. If you have a high school diploma, you can be a certified addiction technician, which is an entry-level position. We see a lot of technicians maybe working in detox centers, residential treatment centers, doing a lot with, a technician can't work independently, but they can be supervised, so they can perform some of the duties, but they wouldn't be able, for example, to go out and open, Mary McMahon counseling and work independently as a treatment provider, right? So they're the entry level. I don't know if some of you remember the CAC 1 or the CAC 2, the CAC 3. Your technician would be more like what a CAC 1 would be doing. Does that make sense? Okay. If you have an associate's degree, it's still the CAT working indirectly with clients. It's still an entry level position as within associates. Your bachelor's degree, social work, you have bachelor's degree in social work, right? And if you have a behavioral health bachelor's degree, you would be eligible for the certified addiction specialist. Okay, so bachelor's degree in psychology, social work, human services would work. However, a bachelor's degree in sociology or criminal justice or nursing does not qualify for the certified addiction specialist. They don't consider those degrees to be behavioral health. Okay, a master's degree obviously gets you licensed, right? So any of you that are pursuing your master's, you can get licensed as a clinical social worker, as a licensed marriage and family therapist, as a licensed professional counselor, licensed addiction counselor, right? So we always encourage individuals to go all the way towards that master. And then certainly your doctorate will give you a clinical psychologist, teaching, that sort of thing. So the more education, right, the higher level education, the higher level of treatment services that you're doing. Does that make sense? Any questions on that? Yeah.
Just with the social work and the bachelor's, that doesn't, they're not licensed, is that correct?
Right.
In Colorado.
They're not
So
licensed, right?
I'm an advisor
Go, sure.
and I work at a community college, so I'm looking at the high school and my associates because a lot of my students won't get past that.
Okay.
But they're so wanting to work in this field. Just trying to think about what to tell them I can do. Right, so if they want to do social work, if they're not licensed, what are they doing?
So they could do the specialist,
Okay.
right? And so when I say a certified addiction specialist, that individual can practice independently. So I can, with a specialist, I can hang my shingle and my name up there and provide addiction treatment. Plus I can do the co-occurring because I do have the bachelor's level and I have taken the additional training. So I could practice independently with the bachelor's degree in social work as a certified addiction specialist. Yes.
And kind of to segue off that, I'm also at the community college. One of the things that concerns me is that when we look at the vast number of individuals needed to work in this field, and I look at that chart right there, there's only about, there's less than half of the people in Colorado have bachelor's degrees or above, so it's like, has there been discussions about looking at skills and competencies rather than degree levels? Because there's also the equity piece of who gets degrees in this state.
Mhm.
So that may be a very loaded question, but one of my concerns about this field is that the reason we're not getting enough workers in the field is that those standards are so high.
So that's a great question, and maybe it is a loaded question, but I'll just give my opinion on it.
Yeah.
Okay, so I mean,
Yeah,
that's what right it is. So I believe, when you look at like national standards for, and I'll just focus a little bit on the addiction piece. The national standards, like to get the NCAC 1 or NCAC 2, you do have to have the education piece behind that, right?
Okay.
So Colorado is sort of aligning with national standards. We want to make it so that if you're got a credential in Colorado, that you can move with that more frequently or more easier to a different state if you're moving on, right? We don't have reciprocity with other states, so when somebody comes here, they have to go through quite a process to get the certification or the licensure in Colorado. We're trying to simplify that a little bit, so aligning with national standards is what we've done. So recently, we had a Senate bill that passed that gave us additional funding for individuals to get bachelor's degrees in Colorado, and then that we will pay for that, as well as individuals working on master's degrees. So we will actually pay for that education for individuals to expand, if they want to be a certified addiction specialist or not. We also do can't talk, right? We review the degrees, sometimes on a case-by-case basis as well. So we might say, criminal justice or sociology doesn't work, but you know what, let's do a CCE review, Center for Credentialing Education. Let's take a look at it and see what that looks like. For example, we have a lot of individuals at the master's level that have the master's in forensic psychology. So it meets all the requirements for a clinical master's degree. However, maybe they didn't have a practicum or an internship. So as a training program, we offer a field track where we'll provide you the hours or have you get the hours to do that. So that doesn't prevent you from getting that degree. So we're trying to work like funding and scholarships and grants to really encourage people to continue on with their education.
Thank you.
Yeah.
Just a follow-up on it, probably I just missed it, but there's no reciprocity at all for.
Not from Colorado with other states. If you look at it, most of our states all have different requirements for addiction counselors. So in Colorado, to be licensed, you need to have a master's degree. In North Dakota, to be licensed, you need a high school diploma. New York, very different requirements than here, right? So aligning with NADAC, which is our national standard for addiction, right? We're trying to align more with that, so it is, so an individual, it would be easier for somebody moving out to Colorado, or if somebody is from another state and has a national credential and comes into Colorado, it's a much simpler process for them to get what certification or licensure here. Yeah. Good question. Okay. So scope of practice, what can you do? Right? We hear that a lot. Well, what can I do with this, right? So just wanted to remind that, so any license, that means that you're licensed in the state, you can do co-occurring, so you can treat the depression and the opioid misuse, right? You can treat both. You're licensed addiction counselor, so you have a clinical behavioral health master's degree, right? Maybe it's in social work, maybe it's in psychology, maybe it's in clinical counseling, maybe it's school counseling, whatever, right? You have a clinical degree, plus you have the additional training for the addiction. So really, as an LAC, you're like a real behavioral health clinician getting that. Because you have the specialty area for addiction, plus you have the mental health piece, social work piece, whatever that is, okay? Social work, LMFT or LPC, they can treat both as well. So you can do all of those services as well. And substance misuse is included in that as your scope of practice, but your LAC actually has the more specialty area because they have more emphasis on addiction than what you get just in a master's program. Does that make sense? We've heard a lot like, well, we didn't talk anything about addictions in my master's program. Have you heard that? Or maybe you are at master's levels, I don't know. But so this really puts more of an emphasis on that. And then your technician, as we talked about, high school diploma, entry level, they can't practice independently. That's a good way to look at that. And then the CAS, the specialist bachelor's level, they can have their own agency, hang a shingle, do whatever. Okay,
I like to hang a shingle.
hang a shingle out
Yeah,
there, there you go.
I feel like I understand that, but does that the younger generation understand? It's like you put your name on the door and
And then you go, right? Yeah.
you should have a website now.
Have a website. Thank you. Yes.
What would be the benefit in going forward to the lab if you can already practice it in
Mhm.
the past?
So the CAS can do clinical supervision at the CAS level or the CAT level. They can't do supervision for an LAC. And your LAC can do supervision for any level plus other entities as needed. So if I have an individual that I'm supervising that's working towards their social work hours and their addiction hours, I can supervise for both of those things with an LAC. So it's more like a supervisory role for that. Okay. Okay, good. So I just wanted to go over a little bit more like specific about what certification at the technician and at the specialist level is and what that looks like. So we talked about high school, you need 1,000 hours of addiction specific work experience, right? So if you're those first 1,000 hours that you're working on, so you're shadowing people, you're sitting in on groups, you're not doing any specific clinical work because that wouldn't be within your scope, right? But you're gaining that clinically supervised addiction work experience. You're going to pass the NCAC 1 exam. This is a national exam from NADAC that you would need to take and pass. And then the jurisprudence exam is part of the application process with DORA. All the behavioral health entities, when they go to apply for certification or licensure, need to take and pass the jurisprudence exam. That score is good for 1 year. So if you haven't taken it within the previous year and you're applying for a license, you would need to take that. But when you go to renew your license or certification, you don't have to retake the jurisprudence exam. Make sense? Okay. So wanted to include, this is what their scope of practice is and what a certified addiction technician can do. So they can do a collection of the biopsychosocial screening data, service coordination and case management, monitoring compliance of case management plans, skill-based education. So maybe I'm teaching or I'm doing a life skills class, right? It has to be something that's not considered treatment or not considered clinical. So they wouldn't be able to do like relapse prevention or anger management and substance use, right? Because that really goes into, I think, more of a clinical treatment therapy realm. So facilitating the psychoeducational therapy groups with appropriate training and clinical supervision. So they can be in the room, maybe co-facilitating with a therapy group, but they can't do it independently. Makes sense? Okay. Client, family, community, addiction education, referral and discharge, resourcing and planning. So a lot of assistance maybe with the clinical team as far as doing more when somebody is getting released, or we're doing some of those behind the scenes things, right? Like we're helping document the group notes that's then being signed off by the clinical supervisor. Okay. So nothing that they would do independently, but certainly that they could shadow or assist with. Again, you see a lot of technicians working in detox centers. These are the required trainings for the certified addiction technician. So we have training facilities across the state of Colorado. We have a list of them posted on the BHA website. So we have, like, maybe you've heard of Odyssey Training Center or Seven Cedars or Colorado School for Family Therapy. So all of these have the approved curriculum and the approved trainers teaching these courses. And so, like I said, they're available. They're around the state. They'll do in-person or online training. So once COVID hit, we used to, prior to that, have in-person trainings with skill building and all that. Well, COVID came around and said, not today. And we said, okay, so we're going to move everything online. So that's why it's available online. So it's very accessible for individuals seeking those classes. So addiction counseling, case conceptualization, principles of addiction, those are considered our core curriculum. And those are like the foundation that we build on for the addiction trainees. They do ethical practice, culturally informed treatment, Farm 1, trauma-informed care, motivational interviewing, and group counseling skills. Some of these courses at this would have educational equivalency, and some of these do not. Those with educational equivalency, if you are took a course in your bachelor's or your master's program, you wouldn't necessarily need to take that course through this program, because you could show equivalency with your degree. And I think I have a list of those here in a minute, so moving on to the specialist, as we talked about, it's the bachelor's degree. Clinical supervision, you need 3,000 hours. However, you have 1,000 hours from your CAT, so you technically just need 2,000. You don't need 3,000 on top of the 1,000 to 4,000. It's 3,000 total, counting your CAT. Once you have 1,000 hours, you have to be registered in DORA's database as a certified addiction technician or in some other behavioral health entity, right? So if you're not registered, then nothing after your 1,000 hours will count, okay? There's some exceptions to that. If you work at a community mental health center, you're considered to have dean status, so you don't need to register in the database. If you leave that position though, you have to get registered right away or your hours aren't gonna count. If you're a master's level student and you're in your master's program, you don't need to register with DORA's database. However, and you can still be doing all of the work as an unlicensed individual because you're under that degree program getting supervision. Okay. So anyway, your specialist has to pass the NCAC 2. So yes, again, that's with NADEX and then the jurisprudence. Can't get away from that jurisprudence. You're going to be taking that jurisprudence.
What does that name cover?
All the like laws and regulations for the Mental Health Practice Act. For all the different entities. So all the entities are included in that. So this is what the addiction specialists can do. This is their scope of practice, how we talked about that they can practice independently, so they can treat substance misuse and co-occurring disorders, clinical assessments, including the diagnostic impression, treatment planning, referral and discharge, service coordination, addiction counseling for individuals, families, and groups, and then certainly community education and psychoeducation. Okay. So obviously the scope of practice is a little bit more broad with the specialist. These are the required trainings for the CAS. And again, some of these are covered in degree programs. So CBT, co-occurring advanced treatment models, treating diverse populations, infectious disease, clinical supervision 1 and 2, because keep in mind the specialist does have the ability to do supervision for somebody working towards a CAS or working towards their CAT. So we want to ensure that they have a level of clinical supervision in there. Advanced professional ethical practice, advanced MI, pharmacology, and advanced case conceptualization. So your licensed addiction counselor, again, wide range of clinical duties that they can do. So you need to have a master's or a doctoral degree in the behavioral health or psychology, social work, human services. You have 7 addiction trainings through the CAT clinical training program. So what that means are those are the 7 courses that do not have educational equivalency, and you need to take those from a BHA approved trainer. And then those trainers are part of the training list around the state of where you can take these courses at. You have to have 2,000 hours total of your clinical supervision for the LAC. So while you're in your master's program, for example, so I'm a master's student, I don't need to register, I'm gaining hours through my practicum or internship, or maybe I'm working and I have a supervisor that's an LAC, I can count all of those hours towards my 2,000. Other behavioral health entities, you have to wait till you graduate to start acquiring hours. But for the LAC, you can do that while you're in your master's program. You don't need to wait till you actually graduate. So you can be gaining those hours, you can be taking those classes and getting, so when you graduate with your master's, the next day you can take the MAC exam and apply within a couple of weeks, right? So The process is a little bit different that way. And plus, if you're working towards LPC and then you're working towards your LAC hours while you're in practicum or internship, you can count both at the same time. I mean, once you graduate, you're working towards LPC hours, those are post hours. You can still be counting hours concurrently at the same time. You don't need to have separate hours where I have to get my LPC hours first and then I can start working on the LAC hours, right? You can be doing those concurrently. And of course, look what's showing up there again. Oh, jurisprudence. And the MAC exam. The MAC exam is part of NADAC as well. And the MAC exam is also a national credential, the Master Addiction Counselor. That's also a credential. When you go to the CAPS website, they're the ones that set that up for Colorado. You just take the actual exam unless you decide you want to get the credential itself, okay? So these are the 7 courses required at the LAC level, and these are the ones that also do not have educational equivalency. So whether you're going for your technician or your specialist, you would need to take these through a behavioral health approved trainer. Principles of addiction, infectious disease, clinical supervision 1 and 2, advanced professional ethical practice, pharmacology, and advanced pharmacology. These are the trainings that we really want to see someone that's going to be doing supervision and a lot of interaction treatment, that they have this foundation behind them for addiction.
Mary, what is it? You said it has to be approved by a behavioral health approved trainer. What is that process? Who are those individual organizations?
Yeah, so anyone that has an LAC that wants to teach pharmacology. So what they would do would, we have a process. There's an application and a trainer handbook posted on the BHA website. So they would complete that application. They would send they would develop their curriculum, PowerPoint, agenda, references, exam. They put all that together based on the competency for that course. So the competency is also posted on the BHA website. So a trainer knows what's being looked for or asked for in each course. They would develop that and then they would email that to me.
Mhm.
And then I would send that out for review. We have a committee that reviews submitted curriculums. There's a trainer fee with it. And then once all of that gets approved and received, then the BHA sends out, yes, you're approved to train this course. And then your name and information go on our master trainer list through our search program. And that's the program that manages your transcript of all the completed addiction trainings that you have. And then that is accessible to individuals around the state. If I need, I'm working at North Range and I want to have a pharmacology for the entire staff, then I could go to that list and go, somebody that's approved to teach that, I could contact them to see if they come teach that. So you have, like I said, you have a lot of trainers at the different training centers that are available to do that. Yep. So I wanted to make note of this so that you were aware of this. As I mentioned, the Colorado Department of Higher Education did get funding, 15 million, somewhere around there, to provide grants that will provide tuition to students pursuing select degrees and certificates in behavioral health. I want to make sure you're aware of that. So I listed out some of the different universities that are receiving that money. Colorado Mesa down in Grand Junction is receiving that. I don't know if you can see that in the back. I'm sorry, that's kind of small. But Mesa has the BSW in social work and then the master's in social work and then a professional certification in addiction studies. Colorado State, where we are today, your master's in addiction counseling and psychology. They have funding to pay for that if you're pursuing that. The other thing with CSU's program in addiction counseling and psychology, they went through the process of having an MOU with the behavioral health administration, which means that their coursework has already been approved through the training program. So an individual doesn't need to go take those 7 courses somewhere else. They're already included in your master's program coursework. So once you graduate with that master's, you have all of your education piece done. Okay, so with this funding, you get your degree paid for, as well as all the courses paid for. So when you graduate, you need your MAC exam and your 2,000 hours that you could be gaining while you're in the program. Make sense? Yes.
So are these automatic grants or we have to apply for them?
You will have to apply for them. So you'd want to talk to whoever that chair is for that individual program and get like that additional information. But I certainly wanted you to be aware that there's money there and seek out that person, right? Tell me. So anyway, so at the bachelor's level as well. And as I mentioned, CSU at the bachelor's level has the funding for the bachelor's degree, and it has that coursework embedded in their, the trainings from the training program embedded in their coursework. To make sense? So you can also get a master's in human development, family studies, clinical mental health counseling, social work, the joint master's in addiction and counseling. So you'd want to, again, just contact the advisor or the chair of that program and see how you go about getting that access to that money. There's a couple other ones that have this money, is the University of Northern Colorado and the Masters in Clinical Mental Health, Educational Psychology, Foundations, University of Denver, and Masters of Social Work, and the University of Colorado Springs, Masters of Social Work. So if you have any friends that are currently in any of those programs, hey, go talk to the chair of that program, right? Or if you're in any of those programs, you do have access to that money. The thing I want to talk about too as well, is we're talking about workforce and we're talking about incentives and we want to get people in our field and we're trying to ease up some of those barriers, right? Like we know it's a process, but we do want to make sure that we're providing quality services, right? Because we have there's a lot of things going on there right now, especially in the substance world, the opioid epidemic for one thing. We want individuals when we're like, oh, go get treatment, right? Well, we want to ensure when you go get treatment that you're getting quality treatment, that people know how to treat somebody that has an addiction, right? And addiction, as I say that, I've mostly been talking about substance addiction, but there's so many other addictions out there, right? That maybe is a specialty area of training. Let's talk about gambling for one thing, right? Gambling counselors. We don't have very many in Colorado. We have 7, right? Gambling is an addiction too. It's a behavioral addiction, and there's a lot going on with that. Correct? Right? What is right now? March Madness. Anybody betting on March Madness? Right? So, I mean, there's just so much. It just encompasses so lot. So we want to make sure that we're providing that quality treatment to individuals. So what we're looking at is doing pre-licensure stipends and paid internships, getting money into where you can do your internship at, that they'll have money to pay for your internship, have money to assist with that pre-licensure stipend. Career pipeline development grants, like you plan out your career line, this money is going to be available. And while you're working towards that, you can start doing a little bit more service work, right? Apprenticeships, retention grants for behavioral health employees. So you get your CAS and you're working at Larimer County Community Corrections, right? You know what? Let's give you an extra $1,000 for sticking around for a year. Let's give you, and that's not a lot, is it? Okay, give you an extra $5,000 for sticking around for a year. So we're working on providing all of that money, expanding the peer support professional workforce. One thing about peers is we are really expanding our workforce for peers across the state of Colorado. And part of this funding is what is helping with that. The the Colorado Peer and Family Support, or Colorado Peer and Family Specialist is not regulated by DORA. They're actually, it's a different process, and actually the IC and RC, that's a national agency, sort of like NADAC is, but it's a national agency that actually oversees that credential for the state. So DORA is not involved in the peer workforce. So I didn't spend a whole lot of time talking about the peer workforce because we don't regulate them. Does that make sense? But there's a whole process of becoming a Colorado peer and family specialist. And recovery coaches, family navigators, like the spectrum is huge, but certainly such a needed and good aspect to the behavioral health workforce. So we're expanding that. And then piloting a behavioral health aid program. So these are the individuals that would be able to provide case management services with less, not such an emphasis on the education piece, right? But they'll still be able to provide those services, especially in like our rural communities it's really hard to get individuals out there. So maybe you're working with the individuals that you have. Well, how can we retain that and get them a wage that is livable, right? That we can get people into the field quicker that way. This is still in the early pilot process, but it's coming. Okay. Does that make sense? So those of you that, if you want to find like, where can I do an internship or a practice come at? Like, ooh, I don't even know what's in my area. What, like what's in Lamar, what's around Lamar? I don't know. So we have a database, it's called Colorado Ladders, that you can go to and you can type in a zip code or a city and it'll populate the treatment centers that are around that area. And then you just reach out directly to see if anybody's hiring, if anybody's doing internship, supervision, that sort of thing. So I just wanted to make sure that you had access to knowing how to locate or find treatment centers around the state. And then this is my information. Hopefully you can see that. I welcome the emails. I welcome the questions, the comments, the feedback. If you are currently working towards it, addiction counselor, and you have feedback on a training or something, please reach out to me directly. Any questions you have on the certification or licensure process, I'm certainly willing and able to help assist with that. It can get kind of overwhelming a little bit. And we just really want to eliminate a lot of those barriers and just have that process go a little bit further. Once you apply on DORA, the feedback I've got was once you apply for your license on DORA, it could take about 4 weeks. Recently, it's been taking a week. So that's great. Like, we're really trying to minimize that and get all those applications approved in a more timely manner. So. Any questions that you have? I know I talked probably really fast and overwhelmed all of you, I'm sure. So, yes.
You did say that we have access to this conference.
Yes. Yes. I believe so. Yes. I'm sorry.
I believe so, yeah.
Yes. Mhm. What are the questions? I explained that also well. That's awesome. Yay.
So I was wondering, the other exams like NAC exams, could you go into detail a little bit more about what those are about?
Sure. So the NCAC 1 is all of these are national exams from NADAC. And that's what the national exam requirement is to take at each level for the state of Colorado. So the NCAC 1 covers more basic ethics and pharmacology and infectious disease. Really testing your knowledge that nationally you're at the same level as others are, right? Same with the NCA 2, just a little bit more in-depth on theories and treatment and that sort of thing. And then your MAC exam covers all of that plus co-occurring. And there's study guides for all of those exams on the Colorado Association of Addiction Professionals. It's all on their website. And so part of our tech training program that's posted on the BHA website includes our addiction counselor handbook. So it has all these links as well as like CCE reviews and how do you get a hold of somebody at CAP? How do you get a hold of somebody at NADAC? Has all those links in there for your reference as well. Any other questions, comments? Okay, well, I really appreciate your time this morning and being here. I'm giving you back 3 minutes, it looks like, right? 3 minutes of your day, so. All right, thanks again so much, you guys. Have a good rest of your conference. Thank you. Thanks.